All right, we're probably going to have more people joining in a couple minutes, but let's just get started, make the best use of everyone's time. As I said, good morning, good afternoon, good evening, wherever you're joining us from. Thank you so much for being here today. I'm just going to start with a brief introduction of our presenter, Eric Ramirez. He is a senior technical advisor with the Data for Implementation, also known as Data.FI, a global project that helps countries strengthen routine health information systems to optimize efficiencies in the health sector, track and rapidly respond to the HIV epidemic and other emerging health threats, and improve client care through integrated and flexible digital health solutions. Before arriving at Data.FI, Eric was Chief Information Officer for El Salvador for many years, and he also served as an advisor to the World Health Organization, part of the working group to establish technical specifications for a digital vaccine certificate for COVID-19. So we're really, really lucky to have him. He's Data.FI's brain trust for information security, as you might say. And with that, no further ado, over to you, Eric. Please go ahead.
Thank you, Lawrence, and welcome everyone. Thank you so much for taking the time to join us today. So today we're going to talk about information security, and we thought about putting together this presentation based on our experience working in different countries and seeing the needs that we found in these countries related to weakening health programming. So what I would like to cover during this presentation, it's starting with a basic introduction to the concept of information security. What do we understand by information security, and how it relates to the work that we do as international development implementers working in different countries. Then I would like to talk briefly about information security certifications. As you know, there's a number of products in the market that are available, and that certainly help strengthen our organization's standing in regards to information security. Thirdly, I would like to present to you an approach on how we combine these certifications and controls that are out in the market, how to apply them in the work that we do in country, working in the field. And then I would like to present to you an example on how that approach might work in a simple project working with health. And lastly, I will give you a real world experience on how we did that in some of the countries where we are currently operating. So let's go right in with a brief introduction about information security. This is probably something that has been talked about in many forums. It's something that is very, very present in our day-to-day lives, and for a very good reason. Right now, all of us have information up in the internet, personal information sometimes. And so information security is something that has to be always looked into. So what is it that we are talking about when we talk about information security? And here I'm sharing with you a definition from the National Institute of Standards and Technology, which is a United States, an organization in the United States. That has a lot of guidelines in terms of information security. In this definition, we talk about information systems and how we want to prevent unauthorized access, unauthorized use, disclosure, disruption, modification, or destruction of information of our data. And we want to prevent all of that because we want to guarantee integrity, confidentiality, and availability of our information. All of that in regards to information systems. So the question arises, like, what? So we here are defining what information security is, what is the purpose of it, but we also say this is in regards to information systems. So what's an information system? That's the next question. And for that, I have prepared this quick poll. If you can bear with me here, it's fairly simple. when we talk about information systems, what is it that we are talking about? In option A, are we talking about web pages, tablets and phones, devices, gadgets? Are we talking about machines, servers, computers, everything IT? Or option B, are we talking about office space, paper records, people, processes, program guidelines, everything non-IT? So going back to the previous definition, as you saw, it's about protecting information systems, avoiding disruptions, guaranteeing availability of the information system. So in order for us to define what an information system is, can I quickly ask the participants please type either option A, 1, 2, or 3. As you see, option 1 is only column A. Option 2 is both column A and B, or pieces of B, rather. And option 3 is everything combined A and B. Can people please type in the chat just to do a quick poll to see what people understand an information system to be? Great, thank you. I see a lot of threes. That's good. That's good. Excellent. So I think there is an understanding in the room, and at least in this webinar, across all participants, that when we talk about information systems, we are not talking only about technology. We are talking about everything that is non-IT that is shown in column B. So that's great. So moving on, this is very important because that we do as international development implementers. We work mostly in low and middle income countries, also known as LMICs, where digital uptake is lower. And so it is very relevant to think about information security, not only from the text perspective, but also from the non-text perspective, given that we are working in a context where the digital uptake is lower. On the other hand, if you have worked in the field, and I'm sure all of you have experience, you will have seen that participant records that contain sensitive information still being used in paper form. So that's everywhere. That's the bread and butter of every project. Everything starts with a paper form, and those records need to be protected. And so when we talk about information security, it is important that we keep in mind the previous slide. We are protecting the information system, but not just the tech. We are protecting everything that is part of the project, especially paper records and everything non-tech that is part of the routine operation of our project. So staying on that idea, let's go back to what we see in our everyday life. Again, in regards to information security, most of us are bombarded with a lot of guidelines and recommendations regarding cybersecurity, which is good because we all have a cell phone, we all use computers, we all use email. So it's good to have a clear understanding of risk mitigation strategies in terms of digital hygiene, how to develop or implement good software development practices and software management. So all of that is very important. That's in the cybersecurity space. But then going back to what we were just talking about, the non-tech stuff, that's more to do with the operations of our projects, things like the processes, the guidelines, protecting of physical facilities, protecting of paper forms. That's also important as we have just discussed. And so I want to ask the participants, there's two questions in the bottom of this slide. For your experience, the projects that you are involved in, working in, do they include an information security policy or guideline? Yes or no? And does this, and if it does, if you do have an information security policy or guideline, does that document include both areas, operations and cybersecurity? So if I can have participants, please type yes, yes, or yes, no. and to respond to both questions. Let's give it a minute to see if people. Don't be shy, and nobody's really keeping track. This is just oh great, see a yes and yes. Thank you, Sharon. Anyone else? Yes, and sometimes yes and yes. Great. So this is really good news. I mean, we are looking about both areas from the responses that we have got so far. So let's keep moving on. And just to close the idea, and this brief introduction to information security and the scope that we are trying to present to you, the information system, as we just discussed, is more than just the tech. It also includes everything that had to do with the organization of the project, especially the tools that we're using to collect information, how the processes are established or managed, how do we store information, how that information is distributed or used or analyzed. In order to make all that work, we have to define tasks, people's roles, and some of the stuff will be automated through technology. And so to put all of these into a solution or a manageable framework, we have what we will call controls that have to be established at the organization or at the project level. And we also have to define who is in charge of doing what in the operations. And this is where we think about, for instance, who should be accessing what information. Should the data clerk be asking for an ID at the service point? How long information should be retained? All of that is operational. And once we have those requirements defined, then we establish controls. I want to stay with the controls piece here because this is a nice segue to the next section that has to do with certification and controls. Certifications, as you know, there's a number of them out in the market for different domains. Within government in the US, there's the Department of Defense has its own information security framework. NIST, NIST has its own information security framework. So there's a number of certifications out there that an organization can complete. And once you complete the framework or adapt and implement the entire framework within your organization, you become certified, which basically is a recognition that your organization is establishing all the controls and it speaks of your organization's security standing. These certifications can be audited sometimes, and a number of them, like the ISO certifications, can be audited by third independent parties to certify their compliance. And obviously, this is also market driven. So it is a visible differentiator for an organization to have one of these certifications so they can gain a competitive advantage. And here I'm going to briefly show you one of the ones that you probably heard of. It's a very well-known standard. It's the ISO 27001 certification for information security. In this slide, I'm showing you the breakdown of version 2022 of the standard, which, by the way, this is the certification that our company, Palladium, obtained in last year, and that certification was obtained through version 2013, which is the previous version of the standard that you're seeing on this slide. That said, the main idea here, as you can see, is that the certification is providing a set of controls. Once again, the word here is controls, going back to what we just discussed in terms of information systems, defining roles and people and defining controls. So here there's a total of 93 controls, which is a lot. They have to do some of them with technology, but also, as you can see in dark and black, you can see a number of controls that have to do with non-technology things like asset use, non-disclosure agreements, facility security, and organizational information policies. So as you can see, the certification itself is not just tech, and this is something that we agree on. There's also things that have to do with non-tech, and yeah, there is a way for an organization to establish all these controls and become certified, and that's what Palladium and many other organizations have done. On the other hand, you have donor organizations like USAID. They have their own frameworks for security, for information security, especially for meeting the Federal Information Security Modernization Act, or FISMA, in the case of USAID. There is a number of policies within USAID. Here in this slide, I'm only showing you the ones that are relevant to the work that we do as implementing partners in development projects in different countries. We have to be cognizant of these policies, especially ADS 540 that explains how we have to share the products from our work, being text, images, video, maps, charts, everything that comes out of our projects has to be shared. And then ADS 579 that also explains how we should also share the raw data that is obtained through our projects in the field with the donor, in this case USA. So again, there's a whole ecosystem of policies and guidelines and controls within the USA that is different from the previous one, the ISO 27000 that we just talked about. They have their own structure, their own controls, and some of those controls are designed specifically to provide guidance to implementing partners like ourselves. And so all of this to tell you that there's a number of approaches and ways to look at information security. But then the big question is, how do we adapt or implement all of that information in a project in the field? That can be quite complicated. As you can see in the slides, we're implementing partners. Some of us have certifications, like in the case of Palladium, the 27001. There's also, we are working with a donor, in this case, USA. All of our products have to go or comply with some of those policies. And then we are tasked with implementing projects in country. So the challenge here is, how do we design security policies that comply with the in-country policies and also play nicely with other implementing partners and donors that might be in-country? So the challenge again here is for us to identify a way or create a way of thinking about information security outside of our organization, responding to the local capacity, local regulations and context, the resources that they have, and creating something that is actionable for the purpose of securing the information that is managed within our projects. And yeah, as you can see, this can get very complex. And our suggestion is to, stick to the basics, as you saw with the ISO certification, as you saw in the initial definitions. It is a good idea to define controls pertaining to tasks, roles, peoples, and technology. So that's our recommendation, and that's what I'm going to show you for the rest of this presentation, how we have been able to implement these considerations in the field. So when we talk about the first domain that has to do with tasks, this might be very almost common knowledge, or yeah, like no-brainer, something that you do every day or with every project that you work on. But it's important to remember that we need to have a clear definition of the scope that is being asked of our project, understand the programmatic needs and the expected outcomes. And based on that, we have to identify what are the key tasks that have to be completed to achieve those outcomes. And based on that tasks and those tasks, and then we identify and document the risks. So as was mentioned at the beginning, the Data for Implementation project of Palladium Data.FI, we work with PEPFAR funding, a lot of HID projects. So this is something that we ask ourselves constantly, like what data do we need to complete our task? What do healthcare workers need to visit participants for the project that we're doing? What information do those healthcare workers need to do their job? How do we protect that information that we're giving to healthcare workers? So it really depends on the expected outcomes on the type of project. As you can see, this will vary from one project to the next. And that's why it's important to have a clear idea of the outcomes and the tasks that you have in your project. So based on those tasks, you go to the second step, which are the roles, defining who is responsible to do what, and ensuring that we have a way of communicating those responsibilities and implementing controls to ensure that those responsibilities are covered. Some of those activities, some of this work obviously can be implemented through technology, can be automated like data entry or capture, but a lot of it will still have to be completed manually. So again, there is a need to document how these different stakeholders are going to do their job, how much information or access they need access to. If a data entry person is responsible for collecting a client's data, do they have to collect health data or just the demographics? Is that person has been informed about the risk on the information that person is collecting? And once the data is collected, do we have a timeline on when the information has to be destroyed or disposed in a safely manner so that it's not sitting around and exposed? All those things have to be thought of and communicated to the responsible person or the person responsible for completing that role. The third thing is technology that have to do with thinking through what can be automated. Obviously, not everything can be automated. Again, we are talking about context of low and middle income countries with low digital uptake. So perhaps we are working at community level in our project. There's no electricity or very, very poor access to electricity and connectivity and internet and all those things. So all of that has to be taken into account to decide whether we can automate or implement technology to support our project. And if we are lucky enough to have the conditions to do some technology, to add some technology into our project, obviously the recommendation coming from USAID is to always stick to global goods. They have been well tested, documented, and supported, especially because they follow best practices in regards to information security, enforcing password complexity, implementing two-factor authentication, and all those things that it will be just too hard to develop from scratch. So it's always a good idea to reuse, especially global goods. And lastly, in regards to people, we have to keep thinking about managing change. Everybody who is involved in the project will have their previous experiences, their own views, and their own ways of doing things. So we need to manage expectations, manage their skills, what they have to contribute. We have to explain program goals, explain the whole project processes end to end, so that people are clear on how information is supposed to flow, who will have access to what and for what purpose, and the people understand the risks that are associated with the tasks that they're being given, and that they also understand the controls and checks that will be implemented to verify that they are complying. And obviously, this calls for a lot of training, which obviously can be part of the regular trainings that are already planned for the project completion. And the training should be for both things that, again, information security is things that have to do with non-tech and tech elements of the project. So what does this look like in practice? Here's an example prompt. Let's assume we implementing partner, we have been hired to improve a monkeypox vaccination rate at a community level in a country, let's call it Springfield. Not very original, I apologize for that, but this is just an example. And let's assume that Springfield is a country with 10 million inhabitants and a nominal GDP of $5,000 a year per capita. So a low middle income country, LMIC. And our client wants us to show evidence of information security protocols and guidance to protect client data. So going back to what we have spoken about throughout this presentation, the way we will approach this is to start thinking about the tasks that are needed to complete our project, the people and the skill sets that we need in our team. We're talking about monkeypox, so we need to know about vaccinations, probably logistics, definitely point of service care. How do we track people that have been vaccinated? All those things. What roles, who will do what, and how do we train them? Are there people that know how to do that in the country? Then also we have to think about the information that we need to collect in order to show that we are improving the vaccination rate. How much information do we need? And depending on the context, how much technology can we put into the mix? Can we use web forms or tablets, or can we just do we need to use paper forms? And what type of data do we need to do this work? Again, we're trying to increase vaccination rates. Can we do aggregate data, or do we need to follow individuals with their date of birth and addresses? And why? How do we justify collecting that information? And lastly, but not least important, it's make sure that we understand the local data protection regulations, and they are adopted within our project and the paper forms or the solutions that we are implementing to manage client data. So here's a very simplified summary based on the previous example. Again, we have been hired to increase monkeypox at the local level. We're working in communities, we're doing vaccinations. We have to collect data to be able to show that we are improving vaccination rates. So this is just a very simplified table showing what the application of the information security approach might look like. So you have the task, the application or the provision of vaccines that will be done by the nurse, and the nurse will also be doing the data entry, filling up a paper form. The information security control that we will implement at that level is to ensure that that nurse has signed a non-disclosure agreement that includes any language that is relevant for data protection regulations. So again, understanding whether there is a data protection law in country will be important so that we can add it to this non-disclosure agreement. And if there aren't any, then let's look at the donor regulations. I talked about USA. USA has a specific form for this. Most of us that work with USA funding, we are probably familiar with the USA 545-5 form for non-disclosure agreements. So that's something that can also probably be included here. We are collecting data through a donor-funded project, so all of this applies in there. The other control that we can implement at this level is ensuring that the nurse is responsible for accounting for all the paper forms that she is managing, that she has built, making sure that she securely stores those paper forms and tablets, if they're using phones or tablets to collect information at the end of the workday. And the control to ensure that she does that, we can implement a very simple paper form which she signs saying, yes, I checked and there's no papers laying around or laptops laying around. Everything has been stored under lock and key and everything looks good. So very simple control. That's for the provision of vaccines by the nurse. The next level, let's think about tracking the progress at the community level. For this, we are going to hire an M&E officer who's also doing the data collation, analyzing that data using Excel. So the M&E, in terms of information security controls, we have to inform and show and train the M&E officer so that he ensures every Excel file is password protected. So whenever that Excel file is shared for review, it's done securely. And also that if we want to put it in a shared drive, that we use a corporate drive from the company. Most of the implementing partners have a corporate drive. This is something that we're incorporating throughout our countries where we work, just to make sure that people do not use public file sharing services. And this is, we all know that we all have received a reminder from Google showing us a picture from 10 years ago or 15 years ago. We want to avoid that. We want to, an M&E officer receiving a reminder from Google from a report he did 10, 15 years ago, having like client data. So yeah, no public file sharing services. It should all be linked to a corporate service. The other thing is to not use official, to not use public email accounts or personal email accounts. This all should be done using official or project email accounts to share those files for the same reason that the Google example that I just gave to you. And lastly, to assess the progress of the project and review the campaign priorities, the vaccination campaign, we are thinking the immunization director at the Ministry of Health of the agency who's in charge of the project will be doing that work, and they will also be using the Excel files. And they will be in charge of organizing the trainings for the M&E officers, for the nurses doing the work, communicating that mandate that they need to comply, and ensuring those trainings are available to the team members. And also investigating, they will be in charge of investigating any reported incidents from the nurses at the site level, and verifying that there's compliance and the controls that we have established in the previous rows. Okay, so as you can see, this is a very, very simple example. The point that we are trying to make here is that all of this is information security. As you can see, there's not a big high-end health information system. It's just operational, but it does make a difference in terms of protecting the data that we are managing within our project. So that was hypothetical example. Now I'm going to talk a bit more about our real experience. Let's add a drink here. Okay. So Data.FI, as we mentioned at the beginning, is a project that works in multiple countries. It's a consortium of several implementing partners. As you can see on the left-hand side, there's Palladio, which is the prime implementer, and then a number of other implementing partners working with us in this project. It's a 5-year program. We started in 2019, got an extension, and we're going all the way to 2025. So what do? We help countries improve health outcomes, and we do that through enhancing or supporting their health information systems through digital health solutions, supporting their capacity to use data to support decision making, analyzing data, and strengthening local governance structures for the project that we are working on, especially around HIV and COVID. We were asked during the pandemic to support the COVID work. As you can see in this slide, we are present in over 20 countries. Some of them are only HIV, some of them have only COVID, and some of them have both. Okay, so how do we implement this in the field? It starts with again, understanding the context, understanding who is who's doing what, who has the data that we will need to implement our project, and basically understanding the governance structures that might be in place and the scope that every stakeholder has in their hands. From then, the other important point is understanding the context in terms of the country's digital maturity, local regulations in terms of data protection. Is there a digital health strategy? Is there a national data protection act or law? All those kinds of things. And from there, we do what we just did in the previous example: define process, tasks, people, and assess the risks. Given all we know about the context, what are the operational risks that we have? Are we sending healthcare workers to do site visits or client visits? Are we applying vaccines at a clinic? What are the risks that are associated with those tasks? Are we using an information system? Is it web-based? Is it on a tablet or on a phone? And what are the non-digital also risks that are associated with our project? As I show you in the example, the nurse was just filling up a paper form. Still, there's risk of papers being lost and shared, especially now that we all have cell phones with a camera. It's very easy to just take a picture of a paper form and share it. So yeah, training and controls are always useful to mitigate that. Yes, so the controls, designing controls to mitigate all those risks and creating a set of guidelines for the people involved within a project. And once you have all that, obviously communicating all these rules, making sure that people understand the risks and how all of these brings value to the work we do and why is it necessary. So following this approach, we have been able to work in a number of countries. We are working in a number of countries, doing that review applicable data protection regulations, making sure that we have a clear set of guidelines on how to share records. In some of these countries, we are sharing the work with some implementing partners. So having a clear set of guidelines on how those records are going to be shared is important. Also, how physical and digital records are stored at the facility level or at the central level in some cases. ensuring that we have a clear process for identifying and reporting and responding to incidents, starting from, again, the facility level, the local level, and requiring that all the people involved in the project has signed a non-disclosure agreement, even volunteers who might be accessing sensitive or private data. In some of these projects, we have volunteers doing site visits or supporting the project, so it's important that they also understand and follow these guidelines. And lastly, there is also a need. This has come up in a number of countries where we are. All this work is important, and people want to do research and publish, which is we really want to support that. But again, there has to be a clear guideline to make that data sharing safe. So we have developed after-sheet agreements for the purpose of research for external entities who want to complete with research and develop knowledge products. So we do all this work, obviously collaboratively with the local authorities and the implementing partners. And at the end of the day, this document belongs to the local health authorities. This list that you see on this slide is very operational, and I did that on purpose because I wanted to show how, even though there might not be an information system in the mix, there's still a lot of work to do. On the other hand, there might be an information system, and they have in some of the countries where we are working. There's a national information system that is available at the facility level throughout the country. So there's definitely a lot to consider, including, for instance, at the facility level, making sure that the local area network is secure. So yes, there might be one computer, there might be 5 or 10 computers that are networked, that are sharing the internet. So making sure that we have guidance on how to protect those local networks. And provided we understand that most of these assets, networks, equipment does not belong to the project, to our project, but it is in our interest to communicate the risks and to provide guidelines so that the stakeholder who's responsible for those facilities have something to work with and have been informed of the risks. So that's with networks. Also with the workstations, again, making sure that those computers are set up correctly. Basic things like making sure that they're not using the administrator account to do everyday work. Making sure that there's a clear documentation of the information system that we are using. As implementing partners, we know that things change. We might inherit an information system that we did not develop. And so doing everything we can to improve it also helps. And that includes making sure there's proper documentations of how security is managed within the system. And this includes how our groups set up system roles, access rights, all that kind of thing. And then on the operational side, at the facility level or the central level, whatever the arrangement might be in the country, making sure there's clear guidelines on how to create user accounts, how to deactivate user accounts, how to do inventory of user accounts, so that we don't have inactive accounts laying around. All of that has to be documented. Also, just business continuity. This is obviously best practice, just doing regular backups and restore procedures. And obviously, the one thing that we see everywhere in cybersecurity, making sure that the actual application has all best practices that are shared through cybersecurity spaces or forums in regards to penetration testing, attacks, denial attacks, all those kinds of things that have to do with making the application secure. So all of this on this slide, this is also part of a standard operating procedure document, an SOP, that again, we build collaboratively with the stakeholders. And at the end of the day, it stays with the country, with the owner of the project or the data, in most cases, the health authorities. And just to give you an example, this is the work we completed with our friends in Zimbabwe. As you can see in this slide, we produced an information security standard operating procedure. The project there is focused on OVC. And this is a real example where we had to work with a number of implementing partners using the same system. The system was accessed at the facility level across the country. Yes, so all those challenges that I have spoken about and throughout this presentation come up in this experience. And yeah, the same thing we are doing in a number of countries. We are also in Eswatini and Nigeria, where is a very, very similar context. And yes, we're basically following the same structure. So in closing, most of us are thinking about cybersecurity, which is obviously good. It's very important. Please keep doing that. The point of my presentation today is that maybe cybersecurity, especially for the implementing development community, might not be enough, given that we work in contexts where digital uptake is low. Nonetheless, we still manage a lot of sensitive information using non-digital means. So information security is not exclusive to digital solutions, and there's no one silver bullet. We have to understand the context and design solutions that are appropriate to the context. We also discussed certifications, which are really good, especially for our organizations. Obviously, those certifications are very, very comprehensive, and it will be extremely hard to implement in the context of our projects at the community level. And so we are saying here that implementing partners, our community, international development agencies, we have to think more about security in the local context, in the local environment, and how we make that work in the countries where we are. And lastly, there's really nothing new about this. This is, it's project management, it's identifying risks, it's continuous improvement. All of those concepts are coming to the mix. It's the same concepts and ideas, just localized and applied in the local context. If we are able to identify the main pieces of our project, meaning people, processes, tasks, the data, that should allow us to also identify the risks, assign accountability, and design appropriate controls. So with that, I thank you very much for your attention, and yeah, I also welcome your questions and comments. Thank you very much.
Thank you, Eric. Thank you very much, and thank you everyone for listening. We hope you enjoyed, and yes, at this point, you should be able to just turn on your mic, also turn on your video if you feel like it, if you're not feeling too shy, or just put your question in the chat, whatever you prefer. We have a good 10 minutes of time for a Q&A, but we'll try to finish on time. Feel free to raise your hand as well. Hi, nice Shirag. Yes, please feel free to unmute yourself and go right ahead.
Okay, yes, can you hear me now?
Yes.
Okay. Yep. So wonderful presentation. Thank you so much for preparing and going through that. One quick question. In your projects, you mentioned that you have to also be concerned about local regulations in terms of information security. At the same time, if it's funded by USAID, for example, then you have to follow the practices used in the United States as required by the federal contract. Are there any situations where there could be conflict, and how do you handle that?
Great question.
Thank you for that question. Yeah, as I showed in my slide, there's, for the context of the implementation in country, There's only two main policies that apply. I can't remember the two numbers, but once you get the slides, you can verify those. And as I mentioned during my presentation, they have to do with basically USAID is asking that we share the data, obviously if it does not compromise people's privacy in all the products from our project. So that's what it has. That's as far as the USA policies reach for the implementation at the country level. Obviously, USA has a lot of policies for their internal work, but that internal work does not extend, or those internal policies do not extend to the implementation in country. Just like the ISO 27001 that we have in Palladium, and when the office where I'm sitting does not extend to the implementation in country. So there's basically a green field. There's really there's not much to go by, clear guidance, other than those specific instances from USA. This is what needs to happen in terms of sharing the information. But other than that, we really have to look around to see what regulation might be applicable in the country, and making sure that we follow that so that our project is compliant. I hope that answers your question. Over.
Yep. Thank you so much, Eric. Appreciate it.
Matt, please feel free to unmute yourself. I think you have your hand raised. Matt, we can't hear you.
I thank you. May I continue?
Sorry, Teddy, go for it. Go right ahead.
Okay. This is Teddy from Ministry of Health, Digital Health Governance, Ethiopia. I'm asking we need to collaborate with you just as a company, and from your demonstration, how we can protect our data by implementing security protocols, by just considering interoperability concept. Thank you.
Yeah, thank you, Teddy. Lawrence here, he will reach out to people and share their contact information. But yeah, happy to follow up and explore ideas and how this can be implemented in your context. Thank you.
I will say at this point, I did just share our project's LinkedIn. If you're not already following us, we would really appreciate. That's also where you can hear about all events we host and a lot of the work we do in the field. And of course, please also feel free to reach out to us after the talk. I'll share my email address as well, and we're happy to engage further. Any other questions? Any other comments? Yes, Matt, your hand is raised. Can you unmute yourself? See if it works this time. Still can't hear you, Matt, in case you're... Oh, there you are.
Can you hear me now? I apologize.
Yes.
Forgot to turn
not at all.
my mic on the web browser. So this is Matt from USAID. The first question I was asking about the compatibility between ISO 2700 and federal. We do have a lot of regulations, and I live with it every day. My advice is actually this: we follow, like a lot of agency, the NIST guideline, particularly NIST standard, NIST 800. The 853 applies to the federal system. There's an 800-171 that applies to non-federal. The 171 is not explicit in our policy. 53 is. And so in terms of the local decisions, there are a few approaches to go about. You can, if you want to start looking at ISO certification, you can actually put in like I don't know, 10% extra work and actually map that toward NIST 53171, just to cover yourself. If you're already certified for ISO, like Palladium is, you might want to look within the ISO itself and just kind of see how many of those have fulfilled the NIST 171 as well. The other instance is actually to actually I'll stick with those two instances for now. You don't have to expand right now. You don't have to expand if you're ISO certified. You just kind of map it and just be ready for it. You may want to satisfy both. So those two approaches. I know I'm getting a little bit more technical when it comes to all these standards numbers. I apologize. So it's really depend on each organization where you want to go. If you stick with NIST 171, they're both kind of minimal, both ISO and NIST 171. Just, I would review both and just see where it goes from there. I hope that's helpful. And thank you for bringing that question up, because as the US government is becoming more and more aware and more stringent on the cybersecurity, really the data itself, the policy changing, the direction that we're getting from the White House and Congress is rapidly evolving, which is in a way the good thing. I will leave my comment with the last one though. Monitor the privacy part. GDPR, some of you guys might be aware of. A lot of them is actually an additional burden on in addition to the other standard I have that I just mentioned. GDPR is a European privacy protection regulations. It's been replicated in several states in the country. It's being replicated in many parts of the world, Africa, Asia too. Just kind of be aware of that. Thank you.
Thank you, Matt. This is really useful information, especially for organizations that are looking into certifying themselves. Just to put things into context, though, I would like to also say that the presentation, one of the main challenges that we see is that even though our organization can do all this work and become certified, when we go in country and we have a specific scope, there has to be in a period of performance that is limited, let's say 8 months or to a year. We don't have the luxury of exploring how to implement a full-blown certification for a project. It will be too complex. So yeah, I think that the information you share is very useful for organization to do like a midterm, long-term vision. But also I wanted to bring back the point of the presentation, which is let's also think about how we operationalize this and make it actionable in the implementation context where we are. Thank you.
Definitely very, a lot to discuss and a lot more. We could go on all day about this subject, but we are at time, just 2 minutes over. So I want to thank you all again for joining us today. And thanks to Eric for the wonderful presentation. Again, please consider following us on LinkedIn and feel free to reach out to me directly if you have any other further questions, or Teddy, you discussed, maybe wanting to engage further. And Matt, it sounds like there's more of a conversation to be had here. So thank you again, everyone. And with that, I hope you have a great rest of your day.